Hey everybody, welcome back to the 2017 Pediatric Summit webcast series. This year we have something very special for you. We're still doing our 8-part series, but you're no longer going to have me as your host. We have found an awesome student at Life University. She's the president of the ICPA Family Wellness Club, Amanda Haynes. She's from Ohio, plans on opening a pediatric practice out there when she graduates. She is about to start the outpatient clinic here next quarter, and we are so excited for her. I'm really excited to have her as the host this year. Having that student and other professionals questions, and I really love that relationship. So I figured, since I graduated last month, might as well hand it off, let it do its thing, and hopefully you guys get a ton out of this. Hey Amanda, what's going on?
Hey, how are you?
I am fantastic, or I am ready for this this first webcast.
Awesome.
Let us know what we're in for.
All right. Hi everyone, welcome to the 2017 Pediatric Summit webcast. Today will be the first part of the 8-part series, and today we have an honor to be speaking with Dr. Ian. Dr. Ian is a chiropractor in South Florida, and he's made a huge impact on his community, and especially the prenatal community, where he has teamed up with the Palms Birth Center and has a huge impact there and in his practice. Welcome, Dr. Ian.
Thanks, guys. I appreciate the opportunity. I'm looking forward to the Pediatric Summit.
We are so excited to have you. If you would mind, can you just start off by sharing some about you with some of the listeners that maybe don't know you?
Sure. I'm a second-generation chiropractor. I was born and raised in the profession. And when I was in my first quarter at Life, I got the opportunity to hear Dr. Jeannie Ohm, who's the executive director of the ICPA, and I absolutely just fell in love with pregnancy. I thought it was just so amazing and fascinating, and I knew right then and there that I wanted to spend the rest of my life helping pregnant women have the best experience possible. And so I graduated in 2011. I moved down to South Florida. I opened my practice, and at the same time started working with the Palms Birth House, which is the only freestanding birth center in Palm Beach County. And I'm been in practice for those last 5-6 years, and just recently hired my first associate, Dr. Haley Miller, a recent Life grad as well, and we're having a blast helping a lot of moms.
That's awesome. Thank you, Ian. Just curious, what do pregnant women even come in for? And what are some of the cases that you see, and how can you help a pregnant lady?
Well, as you imagine, the majority of women come in because they're experiencing some discomfort. Unfortunately, women have been trained to expect discomfort throughout pregnancy, whether it's low back, SI joint, pubic bone, tailbone, sciatica, round ligament, or whether it's something like nausea, sleep issues, fatigue, whatever it is. Like, women are almost expecting to be uncomfortable and miserable during pregnancy. It's just something that our society has done a terrible job of making women believe and expect. So all of those reasons are some of the most common. That being said, I've built relationships with OBs, with midwives, with doulas. So a significant portion, 40–50% of moms in my practice come in not because they have any specific symptom, but because they want to prepare for a natural birth. They want to have the best experience possible. They want to enjoy pregnancy as opposed to just surviving it. So those are kind of the most common reasons, not only typical aches and pains, but also a lot of women who just want to have a better pregnancy.
Mm-hmm. How does chiropractic care help with the natural birth process?
Very simply is, and I'll use my little pelvis that I have here. When you have a normally functioning pelvis, the pelvis is able to expand and open up to accommodate the descent of baby, right? These pelvic floor muscles are designed to stretch and open up. The uterus, which is anchored in here, is able to move freely so baby can get into the best position. But when this pelvis subluxates, right, when it twists or turns just a little bit, we'll start to see that the pelvic floor muscles will tighten asymmetrically. That affects the ability of the pelvis to open up. It leads to more physical stress on both mom and baby, leading to intervention like action or episiotomy, or just more stress being exerted on the infant's upper cervical spine. What we'll also see is when this pelvis subluxates and it torques the uterus, it has a really profound impact on the ability of baby to get into the best position. Not only head down, I know we talk a lot about breech babies and you know, getting babies to turn into the head down position by adjusting. It's a lot more to do with is actually the position of the head as it engages the cervix. If it doesn't engage properly, you end up with an asynclitic presentation, which can significantly slow down the progress of labor, making it more difficult for the cervix to dilate, putting more stress on both mom and baby. So those two things affect the actual position of baby and the descent through the birth canal. But then simply, if you have a subluxation of the pelvis disrupting the nervous system, you're going to have a body that doesn't go into labor or can't sustain labor, and it leads to more intervention, more stress, and so it's not really a good situation for mom or baby. Chiropractic, very simply, restores balance to the pelvis. It allows the uterus to relax so baby can get into the best position. It helps the pelvic floor muscles relax so the pelvis can expand and baby can drop through. And it lets the nervous system regulate everything the way that it's supposed to. I think chiropractic is not only important for women who want to have a vaginal birth, but I think it should be necessary.
Yeah, definitely. I thought it was interesting how you said that you got a lot of your patients from doulas and midwives referring. How did you establish those communications, and kind of where did they go from there?
As soon as I graduated chiropractic school and moved to the area that I was going to open up practice, I started reaching out to everybody in the birth community, doulas, midwives, OBs, and maybe it was the arrogance of a new doctor. Maybe it was, you know, just a little bit of cockiness. But, you know, I started reaching out to people who have been doing births for 20, 30 years, you know, and I spoke with the confidence because I knew what I knew, which is that chiropractic helped moms have more comfortable pregnancies and easier birth. So I started reaching out, and I talked to them about specifically how chiropractic influences the pregnancy, not only the physical comfort, but also the birth process. And my experience was that there was a whole slew of doulas and OBs who were looking, doulas and midwives and OBs who were looking for this type of work and just didn't know that chiropractic offered it.
Mm-hmm.
So I started reaching out and connecting, and I had a lot of meetings. Some of them were fruitful, some of them were duds, but I just kept introducing myself and showing up over and over and over. And my message was always, helps for an easier pregnancy and an easier birth, and I just said that to everybody. I said that to men who weren't, you know, married and had no plans of having kids. Right? I told it to everybody, and it just grew and grew and grew, and now about 70% of my new patients are either pregnant or within the first year of life.
Wow, that's awesome. That's so cool. Why do you think that midwives and doulas, like, what are you saying that's so special that they take to it?
I think whenever you're talking to somebody, whether you're talking to a prospective patient, whether you're talking to a referral source, whether you're talking to other professionals, you want to talk about chiropractic in a way that has them see value for their own practice, right? If you just talk to people about chiropractic, you'll get a lot of responses like, oh, that's wonderful, that's great. And unless they see value in it for themselves, for their clients, then the likelihood of them doing anything or acting on it is very, very slim. So I would always talk to doulas about how chiropractic helps baby get into the best position so it can make birth faster and easier. And, you know, doulas who are used to, you know, 20, 24, 36-hour births absolutely want that, right? They want to have a birth that's easier with less time required for them. Midwives want to have a birth where there's less intervention, where their clients aren't complaining to them about aches and pains throughout pregnancy, where they know that that birth is going to go faster with less concerns and less transfers to the hospital because the pelvis is doing exactly what it's supposed to. So I always talked about chiropractic in the perspective or the filter of what they would be looking for in order to refer. And I do the exact same thing with OBs, right? OBs don't have a whole lot of options when it comes to keeping moms comfortable during pregnancy. They don't like to be waiting around for natural births. So if you can talk to them about speeding birth up, reducing interventions and complications, making moms more comfortable, all of a sudden they're like, that I don't want to have to deal with a bunch of cranky pregnant women. So they'd rather send them to me and then get them when they're not cranky anymore.
Yeah, that makes sense. So what is your relationship like with pediatricians? Caleb and I were speaking and realized that you were talking to a pediatrician and you specifically told them that you do not do sports physicals. So I was just curious, in telling them what you don't do, does that help your relationship with them?
Yeah, I think it's important to create guidelines, to create a distinction of what we offer versus what they offer. And I'm very clear with pediatricians and OBs as well, is my role is to locate, analyze, and correct vertebral subluxations. And in doing so, it lets the body work better. But I'm not stepping on anything that they do, right? I'm not doing school physicals, which actually was more of a concern of pediatricians than even the vaccine topic. So when I spoke to a group of pediatricians and I told them that I don't do school physicals, that my job is to correct correct subluxations and allow the body to work better, you actually had a collective sigh of relief, because what their perspective is that chiropractors are doing things that they're not trained to do. And a school physical is not about a spinal screening. A school physical is about listening to the heart to make sure that a child doesn't have an undiagnosed heart condition that's going to have them die on a football field. So when I pass that on to the pediatrician and say, listen, you guys are the experts in diagnosing things, do that. I'm going to focus on correcting and restoring balance to the spine and pelvis. All of a sudden, pediatricians let their guard down, and they were much more willing to refer to us. So I think what's important is set boundaries and guidelines as to what you do and don't do.
Mm-hmm.
Don't tell patients what to do or not to do in regards to medications. My job is simply to correct subluxations. That's it. So if you have a child that's on a bunch of medications and you start correcting those subluxations, the need for the medication is going to go away regardless of whether or not I tell them. Right? Most of the parents who come into my office want their kids off of medications. So it's not up to me to tell them anything. Be hoping that chiropractic will help their child get off of it. I just simply correct subluxations, and I have the pediatrician do it, which is actually much more powerful, because then the pediatrician sees these changes and they start to value and realize and appreciate what's possible when kids start receiving chiropractic care. So that's when I started getting referral after referral after referral from pediatricians, because they saw a value in it without feeling threatened that we were going to somehow keep kids away from the medical care that's valuable for them.
Mm-hmm. So do you have working relationships with the pediatricians then?
Absolutely. I mean, we're a completely referral-based practice. We don't really do any marketing, financial marketing outside the practice. Mm-hmm. We get, I'd probably say about 70% of our patients are either pregnant or within the first year. Every week we get between 5 and 10 referrals from pediatricians or OBs. I've recently paired up with a local pediatrician, and we've started doing videos and educational series together on our Facebook. We did a Facebook Live event on reflux, and it got a lot of praise from both my patients and his patients, where they really appreciated the tool of the dual perspectives coming together to discuss a topic that is so common. So I think there's this myth that pediatricians are adversaries, and the truth is if we can present chiropractic as something that's distinct and valuable, they're more than willing to refer and connect. It's when we start to step on other toes, right? When we start incorporating physical therapy in our practice, where physical therapists start getting defensive. When we start doing acupuncture in our practice, that acupuncturists start getting defensive. I simply locate, analyze, and correct subluxation. So I get referrals from PTs and acupuncturists and massage therapists and all of these people outside of our practice, because I do what I do and I refer to people who do what they do. And it's a great relationship that I think builds community and helps expose more kids to the benefit of chiropractic.
I'm just curious, how did you find the pediatrician? Did it take like multiple before you found one that you really connected with, that you wanted to do videos with? Yeah.
Yeah, absolutely. Because you want to have a relationship with somebody who's got a similar mindset, somebody who's going to give you some leeway and encourage moms to try chiropractic before they try medication, right? That's what I have right now. But it took, I've met with probably a dozen pediatricians, a dozen OBs, right? Like people that I've met, periodically throughout the year or throughout the last few years to try to build those relationships. And you're not going to connect with everyone, right? So like there's going to be some that are going to be really skeptical, and I've had them where they just gave me side eye the entire time and they didn't believe anything I was saying. And then I've had other relationships with pediatricians where right away they were like, oh yeah, this is awesome. I've got 3 or 4 people that I can think of to refer to you right now. So I think that's available, but you need to give yourself some patience, and it's okay to swing and a miss, so to speak.
Mm-hmm. Awesome. So how did you end up at the Palms Birth Center?
I graduated, I opened up practice, I connected with a bunch of midwives and doulas, and I said, hey, passion, I want to work with pregnant women. I've done the ICPA training, and I think what's really important about it is when I was talking with them, I wasn't talking as a chiropractor. I was talking as a birth worker, as a birth professional. You can't work with pregnant women if you don't understand pregnancy and if you don't understand what women go through. So I did a lot of work leading up to that, where I understood all the terms, where I understood prenatal care, and I understood what the goal of a midwife was and how chiropractic can create a good relationship. And so it created it was an opportunity where the midwives saw me not as this chiropractor that wants to get more business, but they saw me as a birth professional trying to support their mission, which is help normalize pregnancy and birth.
Mm-hmm. Now, you said you introduced yourself as a birth professional. What did you do to make sure, like, what were you reading? What were you doing to make sure that you were a birth professional?
Well, I introduced myself as a chiropractor who focused on pregnancy and pediatrics, but I educated myself leading up to that as if I was a midwife, right? So obviously I wasn't doing clinicals and I wasn't attending births, but I was reading about, midwifery care, and I was reading about complications in pregnancy and how chiropractic can influence it. I did the ICPA training, and I listened to Dr. Jeannie Ohm, dozens of times in different interviews and talks to really understand all of the aspects of pregnancy. You can't just say, pelvis helps it open up. That's too simple. It doesn't make sense. But if I took a look at my pelvis and said, the uterus is anchored to the front by the pubocervical ligaments, by the back to the uterosacral ligaments, by the sides to the cardinal or transverse ligaments. And when this pelvis torques, it twists the cervix and prevents it from opening up, and that's going to interfere with birth and cause a longer stage in labor, leading to more stress on mom and baby. And if we can reduce that interference, it's going to help everything go much smoother. All of a sudden, the midwife can resonate with that because they understand it and they can see value for themselves. So I think part of what we need to do as a profession, and especially as students, the philosophy, not in I'm just going to recite a bunch of cliches. I'm just going to, shout a bunch of spiz from the stage, but master the philosophy as it's your foundation for everything that you do. And then take the science that's available and view it through the perspective of our philosophy. And now all of a sudden you're able to communicate in a way that both patients and providers get it. And then when you master the art, which is communication and technique, now you're able to deliver the goods. And the combination of knowing it, the combination of speaking it, the combination of delivering it is what has you build a reputation as somebody who can, can really build do wonderful things for pregnancy and birth and kids in general.
Yeah. And now that you're delivering the goods, what is your relationship with the birth center like, and how often are you there? What do you do there? What's your role?
I'm there twice a week. It essentially acts as a de facto second location. So some of their clients come up to my regular office. Some of them see me there. I see some of my regular clients at the birth house as well. So it acts as kind of two locations for me. Both myself and my associate, Dr. Haley Miller, are on call for moms in labor. So we make ourselves available and go to births, both at the birth center as well as at people's homes. And we do everything we can to be there to help make their lives easier. I've been called to births when moms were really struggling, and we adjust them and labor kicks in like that. I've also been to births after birth to adjust the baby. One of the most significant cases was there was this baby with tachypnea. Respiratory rate was over double what it was normally, and they were about to go to the hospital, and I was around the corner, and I stopped in and I adjusted the baby, and within a matter of a couple minutes, the respiratory rate dropped down to normal, and baby was able to feed, and they were able to avoid that stop at the hospital simply because chiropractic was available. And I think when, my vision for the world is chiropractic available at every birth for every mom and every baby everywhere. That's what I want to see possible. And it requires not just being available at birth to adjust women throughout the voice, quote unquote, emergency visits.
Mm-hmm. So you do spend a lot of time with the women before they go into labor as well then?
Yeah, I try to get women in to come in for chiropractic care throughout their pregnancy. It's a lot easier to do this work and get them to a place where things are stable. So then at 4 a.m, they don't have to call me out to make a home visit.
Yeah.
And from the very beginning, that when you come in for a consultation, we're going to talk about how chiropractic can not only help you now, but how we're going to support you through the rest of your pregnancy, during birth, as well as postpartum. So when women come to see me during pregnancy, they know that this isn't just a one and done type of thing, mm-hmm. that this is more of a corrective work in nature, that we're going to help prepare their body for the easiest birth, and we're going to see them postpartum to help their body stabilize and recover after baby is there.
And how long do they usually stick with you postpartum, do you think?
Well, I tell women, we plan for about 2 to 3 months minimum, because we know that it's going to take time for all those hormones to leave their body, all those muscles and ligaments to tighten back up, as well as, all the physical and emotional stresses that they experience regardless, right? There's a lot going on in pregnancy, birth, and raising a child. And so chiropractic will support them throughout that entire process. So I set that up early on so that women know that that's part of the plan, so to speak.
Mm-hmm. That's awesome. So one of the things we talk about how you've made a huge impact in your community, and being a part of the birth house has helped you. What else do you see helping, like as far as getting into the birth center? What else has came out of that for you?
I think a bigger mission. Right? Like I always talked about wanting to work with pregnant women and children, and it was singularly focused on my impact and the people that I have an opportunity to impact. And the more I started working with pregnant women and seeing how significant it was, the more I realized that this is something that we need to do, for everybody. I mean, if you think about it, the idea is that a subluxated world makes subluxated decisions. And I think we're seeing a lot of subluxated people making subluxated decisions in our world today. The idea being that if we can correct subluxation and allow people to view the world, interpret it, and respond to it in a clear, unsubluxated manner, we make better decisions and we experience more love instead of anger. And it allows us to deal with the changes and stresses of life and more efficiently. As that if we really want to change the world, and I know this is going to sound very like, chiro cliche, but if we really see the big idea of chiropractic, it's that if we adjust women throughout pregnancy and we have a easy unsubluxated birth, we bring babies into the world in a more peaceful place. We reduce the subluxations in newborns, And it allows them to develop from a clear place where they're not experiencing the world through this dysfunction. And it allows them to make different decisions. It allows them to make different choices throughout their life, interact with people differently. I'll never forget when I adjusted a mom and she told me that the first thing she noticed was she stopped yelling at her kids. That she had a 2-year-old who she didn't understand why, but she couldn't stand. She was like so short-tempered with her. And I was thinking to myself, like, how that's got to affect the 2-year-old as they grow up, knowing that your mom can't deal with you. And so by adjusting the mom, now she was able to have a healthy relationship with that child. So I think if we had, especially pregnancy and birth and that transition into childhood, if we had everybody clear and unsubluxated, I honestly believe that it would change the entire tone of the world. So I think it gave me a bigger mission, and it's why I've been reaching out with students, because even if I got every hospital on the planet to all of a sudden want chiropractors, we all of a sudden don't have enough chiropractors to do it. We're not even making a dent on it. So I think that's something that we really need to work on, in the perspective of dealing with hospitals and pediatricians and OBs and midwives and doulas. But it's also a big part of that is making sure that we have students who can graduate and are prepared to serve pregnant women and children.
Yeah.
So
Awesome.
I think that's kind of the big deal. Yeah.
Yeah. That's a beautiful mission. I absolutely love it. Is there anything else you want to leave with the students? And, you talked about you wanted the students to have a bigger impact. What can we be doing now, and anything you want to share with them?
Yeah, so, school's important. It's going to give you the foundation. It's going to help you understand things. But if you just go through school, just doing the minimum, just getting your grades, doing the minimum in clinic, you're going to graduate and you're not going to be able to communicate. You're not going to be able to adjust. You're not going to be able to do the things that it takes to really be successful and make a big impact the way that you want to do when you're in school. So do things like watch these webinars, go to the Pediatric Summit, shadow doctors who are doing what you want to do. Practice, work with friends, go out and talk to people. Practice now when you're in school, when you don't have student loans and a mortgage and utilities and overhead that you have to cover, right? Practice now so that when you graduate, you can be, hit the ground running and really be successful and make a big impact. I'll never forget, one of my favorite instructors was Dr. Matthew McCoy, who used to teach at Life, unfortunately no longer does. But he said, if you want to make a big impact in chiropractic, he says, you need to see 300 people a week as fast as possible, because until that point, you're struggling and you don't have enough to be able to really give back to the profession. So, I think numbers are useless, other than they're a representation of the value that you're providing to the world, and it gives you freedom to contribute more. So every year I personally donate to research, both through the ICPA as well as the Foundation for Vertebral Subluxation, and I think doing that is really important because it allows us to make the impact that we want to make. So you can serve more later, so you can do more after.
Awesome. Well, thank you so much, Dr. Ian. It's been a pleasure interviewing you, and I can't wait to see you at the Pediatric Summit.
Awesome. My pleasure. Thanks, Amanda. Thanks, Caleb.
Yeah. All right, guys. So that was part 1 of our 8-part webcast. We will be continuing in March with Janaya Von Hassel, who is a mother of an autistic child, and she's going to be sharing with us the mother's perspective. And I'm really excited for that. So if you haven't bought your tickets yet, you can get your tickets for the Pediatric Summit at thepediatricsummit.com. It will be October 6th and 7th. And Dr. Ian, we will see you there.
Thanks, guys.
Thanks.